Thank you very much. My portfolio is to talk about public space. And the first thing we need to do is discover what public space is. You've heard very distinctly from Mark about a certain kind of public space, which was the streets. There are also different kinds of public space. We can talk about them at different scales and different territories and different uses. First of all, a definition, a very simple definition. It's a public space is a place accessible to all citizens for their full use and enjoyment. Very simple, right? Then we start applying this to the complexity of the city. And as Sue Parnell described so amply in her talk, cities are systems of systems, and these systems sometimes are independent, sometimes they interact, and this is certainly the case with public space. And when we talk about public space, we look at the idea of public, and what does that mean? For some, it's about speech. For others, it's about activities. Others, it's the design, the programming, the community use that it has to create situations against loneliness. Cooling is infrastructure and ecosystem services, depending upon the scale that you're talking about. So it gets very, very complex. When we talk about health, we talk about physical health, we talk about mental health. So we have to think about how these things are affected as we think about public space. So there are certain varieties, and you've heard about streets, and we talked recently mainly about European cities and the abilities they had to deal with the streets. I think Remy will probably talk a little more about the global south, but when you think about urbanization, what's happening, and the speed of the urbanization, what is happening to public space in these environments is it's just simply not there because of the way that things are happening. However, certain changes are being made with slum upgrading programs or with ways of creating transportation, access to places such as in Medellin, as you're seeing on the left, or Brazil, as you're seeing on the right, with slum upgrading and the cable cars, and they use the transportation integrated with public space at the landing to create a better community. So, but cars, as we heard, are omnipresent. This is Jakarta. Where's the individual? Where's the walker? How do you get from one side to the next? We're looking at Nairobi. Here, we're seeing the informal settlements. We're seeing gated communities. If you look what that red dot is, that's a gated community. There's public space within the private gated community. So these are other issues that we have to talk about when we talk about public space. But let's look at the United States. Shopping centers. How do you get from one side to the next? You get in your car. Or, as many know, shopping centers are now becoming obsolete because of the nature of our consumer activity and the digital revolution. People are having to think about how to reconstruct and reshape and convert those shopping centers and bring public space in to make them more amenable. So you can see a number of features here: crosswalks, greenery, sidewalks, glass windows on the streets, and so forth, making shopping centers more urbane in a less urbane, that were less not urbane before. Crossing the street, big problem, right? We have to deal with those kinds of things. So there is a school of thought talking about the complete street. And I think Mark really covered much of this material, the way you can think about this public space in a street for different uses, whether it's for the walkers, the bikes, the roads, the crosswalks, the planting, the green area, or whatever. So this is a school of thought that's being put forward as we think about how we can recondition our streets. And measurements are important. How long does it take an older person to cross the street? And where's the refuge in the middle, an island, to be able to cross quietly, safely, and with a rest stop in the middle? We can convert our streets, too, to the greenery and the different kinds of uses. But what I really want to talk about is the different territorial considerations of public space, from the region to the block. So if we can think about regional efforts, we have to think about what are the regional uses of open space and greening. Everything from water, and the protection of our water supply, our food supply, particularly local and nearby spaces, and the more popular conversation we're having right now is about resilience. What are we going to do with public space along our coastal bays? And how will we protect our wetlands? How will we create the safety that we want through public space? So these are integration of different systems here as we're talking about this. You have to think about the water system and the public space system, the flood negation and the public space, the food system and the public space. We've thought about public space as ceremonial space as well. Right here, of course, the Macmillan Plan in 1901 began to think about how to remember our capital and put forth ideas for the central part of this city, which would be executed, public space to give the importance of this capital. And so public space is used for these kinds of things as well. Civic pride. Certainly helps with mental health, I think, from time to time. I'm not sure right now, but at any rate. Public space for gathering. The size of that public space, the accessibility of that public space, the uses of that public space. Here you see a concert or something like that. But there's another issue that you have. Can you vend in public spaces? Who can vend in public spaces? Is there a livelihood component to public space that we need to be thinking about as we plan our public spaces? Exercise, of course, is the obvious thing that we think about with public spaces, and the necessity of having public space proximate to where one lives. And many cities have begun to think about dimensions. How many yards, how many feet, how many blocks should you be away from a public space as you think about integrating that system into your city? And of course, children. Children need public space. In fact, if we think back at the origins of the public health movement and the planning movement, what was one of the first things they did? Playgrounds in schools. The recreation movement was very important. In fact, public health professionals and planning professionals of the late 19th century spoke the same vocabulary. Do they speak the same vocabulary today? I'm not sure. I never heard of a Dale before, right? I don't use that language. You use that language. I'm teasing you. At any rate, we use different No, I read it in the footnote. But it's just an example that we use different modes of conversation to promote the ideals that we have. And I'm not picking on you, Mark. I'm just saying that we all use different modes of ways of thinking about how we express what is good, valuable, how we measure the success of a particular place. A planner might look at this and say how many children are playing in the playground and where they live relative to that playground itself. I think Mark might look at it and say they're going to live how many years longer because they've got a playground, right? So we're not speaking the same language, and we need to speak that same language as we go forward and think about these sorts of things. And then here's another kind of public space. Here we're talking about dealing with water and dealing with the preservation of in many older cities in the United States, we have something called combined sewer outlets, using sanitary sewer and rainwater sewer at the same outlet, and we can't gather it up when there's a big storm. And so many cities are using open space to provide for this ecological benefits as well. Community planning and how we use public space for thinking about community health and so forth. Currently, the Parks Commissioner in New York City is an architect and a planner, the first Parks Commissioner in the city of New York, in the history of the city of New York, who has this profession. And so he has taken many ideas from planning and transplanted them into the planning for the parks. In this case, the issue is poverty and being disadvantaged, and the fact that there are community parks, but they hadn't been invested in. There's a whole system of bringing capital investment into these parks so that the reality of all citizens having the full use of parks will become a reality. And this is just a map explaining where they're doing this, and they're doing this, as was explained, with other kinds of devices through community planning, so that the locals have something to say about what's going to happen in their park. Why is that important in a place like New York? What's the immigration, the level of immigration in New York? Some 40% of the population of New York City are immigrants. And certain immigrant populations have different interests in their public space. So it's extremely important to think about how you engage those interests in the development and design of public spaces. Philadelphia. 40,000 vacant lots. 40,000 vacant lots. Imagine what that means if you live in a neighborhood with 40 or with several vacant lots on your block. What does that mean? It means the lot gathers trash, the lot gathers unsavory people who might be engaged in drugs. It's just a blight on the neighborhood. So over the past 20 years or so, the Pennsylvania Horticultural Society has engaged, here's a public-private partnership, engaged in greening those lots so that at least they have a presence in the community, such as this. A third of the vacant lots are now taken care of in this fashion. So this is very important in terms of what this means for the neighborhood health in many, many dimensions. What we really need is cross-disciplinary knowledge. I think that's going to be the message of all of us on this panel. And research is needed, though we are seeing it, of course, happening. Charlie Brannis has done a terrific amount of work in terms of working on crime and open space and so forth. Recently has done a very, very fine literature review of what has been studied and what hasn't. And then we see another one looking at the results of vacant land and mental health and community. So there's lots to do. There's lots we know what to do, but we need to get together and talk about it. And I'd like to respond a little bit to Sue's talk earlier when she said, yes, we can create a global health, urban health agenda. My question to all of us in this room is, what are the incentives to do so? Thank you.